It's a fantastic meeting. Thanks for everyone, joining, and excellent work from Gox and rest of the team. So I've been involved in the sustainability as a trust lead for a few years, and as a human being, as a clinician, we are all responsible, and we feel that we should take this opportunity to make sure that the impact of globalization and day-to-day NHS work doesn't have a major impact on the our planet, which we've been living in for billions of years. So we all know that for the last few decades, the globalization has had a major impact, and NHS is nothing different. Despite the Climate Act, which was done many years ago, there is a drop in the carbon footprint what we have had from the NHS, but it's still a major issue. So I don't think we can continue with the way we are going in terms of innovation, getting more new kits, more procedures without having an impact, and we need to make sure that we can reduce that impact. So I feel it's our responsibility to take this step further. You have seen this, day to day, and we continue to see the impact what it has on. And we see that NHS is the biggest polluter. There are several reasons for that. Healthcare itself is the fifth largest global emitter, and we do have a systemic strains in terms of burnout in the staff, costs. And in addition to having the environmental cost and to manage the carbon footprint, the amount of energy efficient services we need to implement. So to overcome this, NHS introduced this in 2020, Net Zero NHS, which essentially is a five-pronged approach looking at the reducing the emissions from the hospitals, looking at same at the transport issues, making it more digitalized, and decarbonizing the supply chain, which contributes probably 15 to 20% of our whole NHS, in addition to working on the research, innovation, and other aspects. This one you may have seen in the trust guidances or the newsletters. When we look at the carbon footprint, we've got two issues. One, which is a direct and indirect factors. And the aim for the NHS is by 2040, we need to control all the 80% of the emissions needs to be reduced, which are directly involved, and by 2045, all the emissions. And we can see that nearly around 2/3 of this impact comes from the medicine and medical equipments, and the NHS carbon footprint, the green bit, which is the one which we are initially trying to control. The rest of the bits will fly in as we go in. As I mentioned of the NHS supply chain, if I ask many, each one has got its own. I like this instrument, I like single port, I like multi-port. Different people have different. So if we start ordering or requesting different kit for, in the same hospital or a different hospitals, we may end up with having, less use of those issues, expiry and all those things. So making it more efficient, whatever we supply chain, making it more sustainable, safe, and we can deliver that to the patient what we want to do. So it's a three-pronged approach. We need to be aware about the cost effectiveness, and we do have a social and corporate responsibility, and environment in itself can't be left behind. So it's a mindset what we need to change as a clinicians and everyone who's involved in this. So a couple of years ago, along with the trust team, we introduced the 5-year plan, which essentially fulfills with the same as the NHS goals, looking at 5 footprints. One is carbon reduction by transitioning to renewable energy, and similar to travel and workforce and leadership. But this is not possible without, we need to have long partnerships with all the this is where we may have to get involved with a lot of non-NHS organizations, the electricity providers, the new renewable energy aspects, and also we reduce the inequalities in each hospital or each region, what they have with this respect. So in left, we introduced few, which is along with the other colleagues. The first one was gloves off campaign. I think it may be in few hospitals already. It was one of the difficult ones to introduce because during COVID, we said, no, you cover up as much as you can, wear gloves, wear masks, gowns and everything. And now suddenly changing that, we don't need to do anything. You just try to do. So, but slowly by making people aware that if there's dry tissue, you don't have to, if there is no blood, any contaminated fluid or blood, you don't have to wear gloves. So that transition is difficult, but by regularly, adapting and letting them know that is possible. Similarly, one of the other important ones is the nitrous oxide, which is being in a high global warming potential. And this is the important one. It's a long atmospheric lifetime of 110 years. So it's impossible, continue to use. So we have managed to decommission the manifold, which was helpful to switching it to the canisters, and thus it has reduced the use and reducing the, giving us 5 to 10% of carbon footprint reduction with that. Mruga Diwan, she was one of the anesthetic champions. So she introduced along with the team theatre caps, and she did an excellent job of, so we are reducing the use of theatre caps as a reuse disposable ones and getting it up to saving up to 50 to 60,000 over 3 years. This one, I think, I'm sure it is introduced by the Royal College of initially by Edinburgh and then accepted by all the colleges, which essentially goes through when you book a patient for theatre, you look at, is it pre-op planning is done? Are they, suitable for day case surgery, or should we make it as a default as a day case surgery? Then when they come to the anesthetic, you use the, reduced use of nitrous oxide or other inhalational drugs, which are more carbon pollutants. By that, we could, improve the targets and get closer to the net zero targets by 2040. And it was alarming to see that over 90% of the staff weren't aware when we introduced this as a, just to try whether are you aware and can you make this. And then it comes to the surgical operating as well, use as minimal, kit required. Sometimes you see nurses will come or doctors will come and open 3 gowns, 4 gowns at a time. So just looking at every step what we do, they can do. Coming to urology specific, we are probably second largest, department after, either you can say orthopedic or general surgery. And we start from, number of outpatients have been increasing every 10 to 15% every year. In addition, we do lots of investigations compared to some other specialties, scans, MRIs. And in addition, we use plastic materials. We use catheters, the stents, similar things. So we need, and finally on the operating theaters, high energy consumers. So having a good use of those and making, the sustainability at every level will help us to get better for the planet. If you look at the 3 main important ones among this, one is reusable instruments. So it's been a debate which goes, one to other. There are companies which will show that disposables are better. Some companies will show that, reusable. As a standard, if disposables were better, we would have used all of them. We don't think so, but reusable at the same time, because of the move of the sterilization procedure outside the hospital and all, they have become much more carbon pollutant. So having a good use of both is essential. Green endoscopy, there is a move towards doing the cystoscopies with a minimal, at the 1 sheet or something, rather than, if you speak to the senior consultants 10, 15 years ago, patient used to lie 5 in a row and you do one after the other cystoscopy and finish. You don't even need a gown and things. So we don't have to go to that level, but somewhere in between, which is acceptable to the patients, would be good. Teleurology, I think this has been a bigger change since COVID, and that has given us. So I'll take another 30 seconds. So teleurology has been a major change after COVID, and we have probably moved 10 years ahead with the teleurology. And finally, with the robotic and minimal surgery, we can move it to day case procedures. And this is some evidence supporting, single use is less pollutant, but if you take out the processing as the major cost. This is the ELA audit, which is thanks to everyone who is supported from this protocol. What I want is, as a leaders, we need to make sure that it's embedded in our clinical pathways, and we need to make everyone aware of these things. And the last point is being conscious about it, and every instrument when you use, think about, do I need to open it? Do I need to use it? Or can I do it in the things what we do? And the final comment is, we do not inherit the earth from our ancestors. We borrow it from our children. Thank you.